Hey guys, if you clicked on this video, you probably want to know what to expect out of DA school if you decide to go to DA school. But there's 4 major ones that you actually want to pay attention to. And the first one is pouring a model. You're gonna want to know how to pour a model for sure, because you're gonna be taking a lot of impressions of people's mouths, and pouring a model is very, very, very important. You want to make sure you can get accuracy on the gum margin of the teeth. So I have a model here that I poured. So if you see here, the teeth are here. Let me take off my retainer that I made here. Okay, so there's teeth here, and then here's the gum line. That margin is something that you want to make sure you're able to get. It's very important, especially if you are doing crowns or veneers, partials, stuff like that. That is very, very, very important for the lab, for the dentist, for them to follow whatever guide they need. They need that gum line. 110% they need that gum line. Another thing is, when you pour a model, you want to make sure there's no bubbles in the teeth. So when you go to DA school and you learn how to pour these models, you're going to be using like a vibrator, a vibrating pad, and you're going to put, after you pour it, which sooner or later I'm going to show you guys how to do it on camera. And the vibrating pad that it is there for you to put your mix on, it's going to vibrate and it's going to push all the bubbles to the top. You want to make sure all the bubbles are gone before you actually start to pack on the rest of the stone or whatever you're using. Usually this is stone. Whatever you're using to pour at that point. 2, taking x-rays. That is very important. Taking x-rays is very important. That's how the doctor diagnoses cavities and infections on the root of the teeth, to know if the patient needs to go to endo, to get a root canal done, stuff like that. X-rays are very important, especially if you have a patient that comes in that has pain and doesn't know what's going on. You're gonna be taking a lot of x-rays. So don't think because you hurt the patient while taking x-rays, because it's very uncomfortable to have that stuff in your mouth. That's why you're going to school. You need to have the right positions when you're taking the x-rays. Have the tube head face in the right position, and do it as quick as possible. That way they don't have it in their mouth for a long time. A lot of patients gag and no one wants to clean up throat. Number 3, I would say know what a basic kit is, because you're going to be using that basic kit a lot. Almost every patient gets a basic kit from a doctor. They're going to come in, you sit them down, you put their bib on. For one, you're going to go through their medical history. You need to find out if, anything has changed, or before you take x-rays, asking the question of, are you pregnant, or are you trying to conceive? You want to try to put it into an understanding for them to understand you're not trying to call them, fat, or, be disrespectful in a way, because when we say things, it probably comes out a way that people don't understand all the time. The basic kit, going back, so the basic kit is a mouth mirror, which you'll learn it there. A mouth mirror, which they use to see the inside of the mouth at indirect vision, an explorer, and a cotton plier. So little tweezers, an explorer which means like a probe, and then you have your mouth mirror, which that's all 3 is a basic kit together. You're gonna use that on every single patient. I would say 4 is sterilizing, learning how to sterilize, wiping down your room, flipping the room. Sterilizing is going to be a huge thing for you as a DA. just learning how to do it is very easy. Keeping up with sterilization throughout the day is very hard, especially if you're the only assistant in the office. You try to split that responsibility with whoever you can split it with, whether it be the hygienist is responsible for theirs, or you're responsible for yours, or if you're going back and forth with front desk to back to out back, or going from up front to out back, as in clinical team wise. Usually front desk doesn't leave the front to go back and sterilize, but you know, it's kind of like hand in hand. When you are supposed to go up front to walk out a patient, answer phones, stuff like that, it should be vice versa, where they should be able to float back when they are not busy at the time, or they know that, you know, you're stressing in the back. Float out, float to the back, and help with sterilization. So that's things that you're pretty much going to expect. You're gonna expect that you're not gonna have that much help if you're the only person or only DA that's there. So don't get frustrated. Just, you know, try to work through it. It's not a simple job, but it's repetitive. So stick with it. I promise you there is benefits to it. Stick with it. So now I went over 4 of the most basic things that you're going to be having to expect out of DA school. Really, one most important tip would be to learn your doctor. Learn your doctor. Every doctor does not do this. Well, they do the same procedure, yes, but they do it differently. You might have, when you're doing a filling, you might have a doctor that wants to use a specific instrument while doing the procedure, like a composite, which is a filling. You have a doctor that will do it with a specific instrument that they always use. And then you have, you know, let's say you go to work in another office, you're gonna think, hey, you know, well, my doctor did it this way, and he always used, or she always used, this specific instrument. That doctor might not use it at all. So what helped me is, in scenarios like that, I put together a universal kit that has the basic instruments that you need for a composite after you learn the doctor. So you're gonna do the composites with the doctor, the fillings with the doctor, and you're gonna learn what instruments that doctor uses, and you're gonna make a kit just for that doctor. And let's say you have multiple doctors that come in, just write the name on the kit. Hey, when you go in back, you go back and you sterilize it. You put it in the autoclave. When it comes out, just write the doctor's name on there. You know that that doctor uses this kit, and you won't have like a mix-up with it. Okay, I'm out. If you guys like the video, give it a thumbs up, and I'll make another one just on stuff like this, you know, what to expect and how to do specific procedures. I'll go over different type of lingos that DAs use inside the office, so you're not kind of like lost with other DAs or with doctors or people that have been in the field for a long time. Yeah, so give it a thumbs up or subscribe. That way I know I can keep making the videos. Bye. Thank you.